Okay, let's talk about one of the most common images in all of medicine, the chest x-ray. At first glance, it just looks like a black and white photo, right? But if you look closer, you'll see it's this incredibly complex map, absolutely packed with hidden clues about what's really going on inside our bodies.
So that's the big question, isn't it? How does a doctor look at this haze of shadows and bones and manage to spot that one tiny detail that could literally mean the difference between life and death? I mean, what a challenge. Because while the chest x-ray is an unbelievably powerful tool, the stakes couldn't be higher. Missing one subtle little sign could mean a delayed diagnosis for something really serious, like a collapsed lung or a bad case of pneumonia. You see, every single shadow, every line, every shape on that x-ray tells a story. The real challenge isn't just seeing them. It's about reading them in the right order and understanding what they all mean when you put them together. And that brings us to the core problem. With just so much information crammed into one single image, how do medical professionals make sure they don't overlook something critical? How do they tame all that chaos?
Well, the answer is actually pretty simple. For a complex image, you need a simple system. Think about it like a pilot's pre-flight checklist. It's this structured routine, and it's designed to guarantee that nothing, no matter how small it seems, gets missed. And in the world of radiology, that system has a name. It's called the ABCDE approach. And this simple little mnemonic, it's the secret weapon doctors use to systematically crack the code of every chest x-ray they see.
So what is it exactly? Well, the ABCDE approach is a step-by-step method that basically forces the person reading the x-ray to look at specific things in a specific order. It turns what could be a really daunting visual puzzle into a process you can actually manage. And the checklist itself is just brilliant in its simplicity. A is for airway. You're checking, is the windpipe straight and clear? Then B is for breathing. You're looking at the lungs and their lining. C is for cardiac, that's the heart size and shape. D is for diaphragm, examining its position. And then finally, E is for everything else. The bones, the soft tissues, any medical devices you might see. Now, having a system is great, but its real power comes from knowing what you're looking for. Within each step of that ABCD check, doctors are on the hunt for very specific visual patterns. These are the telltale clues that point to major diagnoses. Let's start with B for breathing. One of the first huge clues a doctor looks for in the lung fields is something they call consolidation. And this pattern, it's a key sign that often points to an infection. So let's see how this works. When a doctor sees a homogeneous opacity, which is basically just a solid-looking white patch, but they can still see the dark outlines of the airways running through it, those are called air bronchograms. Well, the top diagnosis is almost always pneumonia. The system leads them right to it. Okay, another absolutely critical finding under B for breathing is seeing a visible pleural line. This isn't just some interesting shadow, it can be a sign of a life-threatening emergency.
The clue for a pneumothorax, which is a collapsed lung, is incredibly clear once you know it. It shows up as this sharp, defined line where the lung is actually pulled away from the chest wall. And beyond that line, there are no lung markings, just blackness, which is air. And if that air starts to build up and push the heart aside, it becomes a tension pneumothorax, and that is a true medical emergency.
All right, moving on to C for cardiac. The heart itself gives us a ton of information, and one of the most important clues is just its size compared to the rest of the chest. And the crucial clue here is a really simple measurement. On a standard chest x-ray, if the width of the heart is more than 50% of the total width of the chest, that's a condition called cardiomegaly. This is a major red flag for heart failure or other cardiac issues, a really powerful clue that's just hidden in plain sight.
But here's something really key to remember. The image itself, even when you read it perfectly with the ABCDE system, is never the full story. It's just one piece of a much larger diagnostic puzzle. Before they make any final call, a doctor runs through another mental checklist. They confirm the patient's name, the date, they check the technical quality of the image. Was the patient positioned right? Did they take a deep enough breath? And most importantly, they connect the findings on the x-ray with the patient's actual symptoms and other test results. A finding on an x-ray has to make sense in the context of the actual person sitting in front of them.
So, as we start to wrap this up, let's circle back to that main idea. We started with this complex, kind of intimidating image, full of potential traps and hidden dangers.
And what we've seen is that the ABCDE approach is the key that unlocks the whole thing. It transforms that chaos of shadows and lines into a clear, solvable puzzle. It gives you a reliable path through all that complexity, making sure that every single corner of that image is examined methodically every single time.
And that leaves us with one final thought. The power of a simple, systematic checklist isn't just for medicine, right? It makes you wonder, what other complex, overwhelming problems in our own lives could be made clearer and maybe even solved more effectively just by applying a simple, step-by-step system?